Hi guys, welcome to PrepLadder NEET-SS. This is Dr. Santosh Patil, your medicine educator for NEET-SS medicine. Along with Dr. Dilip and Dr. Ganga, we cover the entire breadth of medicine that is required for you to crack NEET-SS. Now today we are connecting not on an academic topic but rather equally important topic that's about career in medicine. This video is mostly addressing those students who are just beginning their medicine career or those who are into internship or undergraduate programs and they're thinking of choosing internal medicine as a career option. Now, for those who have just started their residency and you don't know how the future is going to turn out for you, whether you need to or whether it has become mandatory for us to get into a super specialty program or you can stick to medicine and stay happy with that. Okay, those things are relevant and we will be discussing that. Second, if you are going ahead with super specialty, what are the options? To what specialties you are eligible? We will be discussing on that. And equally, financial matters are definitely important. That too, in a time where the number of postgraduates coming out with medicine training is increasing, so the financial freedom may be proportionately shrinking. So, how do we deal with that? That's what we are going to discuss today, right? So let me first start, and also those who are beginning the residency, I would welcome them to the fold of medicine. It's a beautiful career. And to start with, let us first discuss about the options after you have completed your MD internal medicine or DNB internal medicine, right? Most of us are either into an MD program or a DNB medicine program. So once you have done with MD or DNB, what are the options? One very logical path we all know is to get into a super specialty, right? So let me call it as SS. Now, what are the super specialties a MD medicine or a DNB medicine graduate is eligible to take part? Now, all those specialties which are listed under medicine, you people are eligible, right? So that includes your gastroenterology, then it includes neurology, nephrology, it includes cardiology, it includes. Now, apart from these four core specialties, right, it also includes endocrinology, one of the fiercely fought out specialty. Okay, but that's not all. We have a lot more specialties which have a lot of bearing on medicine, and that includes critical care medicine. I do understand that many people who opt for critical care medicine are from the anesthesia background, but it is listed under medicine. So if you're taking up NEET-SS examination, you will be giving a medicine paper and not anesthesia paper. So you have an advantage. If critical care is your aim, you have an advantage. Okay. Then medical genetics, an emerging branch, very important right now. Countable number of medical geneticians are there in the country, and if you are beginning your career right now in medical genetics, future might consider you as legends because you probably set a lot more understanding of genetics in the coming years ahead. So medical genetics is another option. Then you also have medical rheumatology. Okay. Now, among all these specialties, the difficult one to get after your medicine is endocrinology, an extremely fiercely fought out specialty, rheumatology, then comes in the list gastroenterology, especially the top institutions. And then after that, I would probably consider nephrology. The neurology and cardiology are relatively easy to get into. Medical genetics is altogether a different ballgame because there are few seats, and until recently it was relatively easy to get into. Not many people were writing the entrance exam for medical genetics, but last 2 years I do see that plenty of students have started or opting medical genetics. So when the NEET-SS used to be based on two paper model where there was a core specialty paper and the general paper including many feeder specialty subjects, at that point of time maybe 150 or 200 students opted medical genetics as one of their choices. You were allowed to make two choices. Now that NEET-SS is streamlined and you write only one paper and medical genetics comes under medicine, it is going to be, I would say, you have an advantage if you are coming from medicine, right? Okay. Critical care, plenty of competition from anesthetists, but being from medicine, you definitely have an edge here. So because the selection will be based on your PG exam level medicine, basically Harrison. So you have an edge here, and if you are aiming for or if you're interested in critical care, definitely you can consider. Right. Apart from these, there are various other specialties which are relatively not so well known, especially those who are beginning their career in medicine. That includes infectious diseases, Now, when it comes to infectious diseases, there are few well-known DM programs, and but there are also good number of fellowship programs in India as well as abroad. So for infectious diseases, as of now, the career does not demand that you should go in for DM, right? Even with fellowships, you will get reasonable placings in good branded corporate hospitals or in good academic institutions, and you can have a mix of medicine practice as well as infectious diseases practice. Or if you are aiming for the kill, you can definitely go for DM. So you have fellowships here for infectious disease, and you also have DM programs. Okay. Fellowships include various locally recognized fellowships like those universities or institutes that are running. There's also FNB program run by the National Board of Examinations for infectious diseases. Okay. So that is one specialty that you can be aware about. Now, among these specialties, right, some of the specialties require core commitment to the specialty. You probably cannot continue to practice as an internist. I don't mean that there is a legal binding on you not to practice internal medicine. Once you are a graduate with an MD or DNB in internal medicine, you can practice it regardless of your super specialty training. But the specialties are so demanding that you will probably not be able to give time. For example, cardiology. Once you're a cardiologist, it becomes extremely difficult to practice internal medicine. And obviously, you'll also probably start forgetting things from the internal medicine. Same, I would say, for gastroenterology, nephrology, neurology. Endocrinology might give you a little flexibility to practice internal medicine as well as endocrinology. Rheumatology might give you a little flexibility. You might have a little time, but again, rheumatology, you probably start seeing the high intensity cases. Medical genetics, I would say that it definitely demands a little bit of academic and research orientation, and probably you would be spending less time on general practice and you would be spending more time on the high end laboratory medicine. Then critical care is basically medicine, right? It's not so different from medicine. Its only thing is that you have a medical patient or surgical or something whom is being treated in a critical environment, and nothing more than that. So yes, critical care medicine might allow you to carry forward your internal medicine practice, but again, critical care medicine is a high intensity zone, and most of the practitioners feel that once you're inside this hot air oven, it's very difficult to make time for anything else. Many critical care physicians do feel burnt out because of the high intensity workload that happens there, right? But infectious diseases, yes, it does give you a flexibility to practice medicine as well as infectious diseases. Okay, so that is one more program you need to be aware about. So that is about super specialty. You obviously have a choice of continuing with internal medicine practice. Now, many of us will face this question: should I jump into an SS program or should I stick to internal medicine practice? And I think I'm one of the right person to give you a perspective because I've gone through all these dilemmas. So when I started out after my post graduation, the thought was to get into a super specialty training. So I thought initially my longing was for critical care medicine. So I chased it. Once I was able to get the critical care medicine, by that time I had practiced 2 or 3 years of internal medicine, and I did realize that it doesn't suit me. The kind of work life balance I was looking for, critical care medicine doesn't offer. So then I started exploring other super specialty options. Then started thinking of endocrinology or rheumatology, which gives you a good balance of work life balance. The other specialties, right? For example, cardio. It's an intense specialty. You might have emergencies cropping up any part of the day. So you do not have fixed office hours. In case of endocrinology, yes, you have fixed office hours. You can say, oh, yeah, my OPD is between 7 to 9 a.m. or 8 to 5 p.m. And after that, I'm absolutely not available. It works for endocrinologist. It might work for a rheumatologist, but it won't work for a cardiologist. Your career will start tanking if you're shutting off your phones after your official work hours because you need to be available around the clock. Same applies to neurologist. Same applies to even to some extent to gastroenterologist, because there can be medical emergencies in gastroenterology too, like an upper GI florid bleed which needs an urgent intervention. Those are all common scenarios. So you have to make a choice whether you want to take that plunge into super specialty or you want to stick to the internal medicine route. Okay. So first question is, if I stick to internal medicine route, will I be able to earn sufficient? Will there be a financial problem? Is it mandatory for me to get into the super specialty training? Because you might have heard from the seniors and generations of doctors saying that now the time of general practice, general internal medicine practice is gone. It's all of super specialty era. But in your 3 years of residency, you will realize that medicine still holds a very, very important space in medical practice or in patient care. You probably would start realizing that most of the super specialties over time get tuned in such a way that the specialist starts seeing patient from only their specialty perspective, or I would rather call it as tubular vision. Right, you would probably notice that a chest pain for a cardiologist is cardiac until otherwise proven. Chest pain for a pulmonologist, once he is not thinking of cardiac as a cause, he would probably think respiratory origin. Similarly, most of the symptoms, right? Each specialty will start thinking from their perspective only. And there needs to be someone to put things together and ultimately help the patient to make informed choices. And that is where the role of internist comes into picture. So all super specialty hospitals even now need a general medicine department. So you can make a career out of internal medicine practice and it's not gone yet. That's the fact that you need to realize. And as more and more super specialists start coming out, and there will be conflicting opinions between different specialties, there always will be increasing demand for someone who can put pieces of the puzzle together and solve it. And that role is well done by the internal medicine people. So you can have a career. I don't think for at least next 10 to 15 years, it's going to be difficult for an internal medicine graduate to find a job. Now you walk into any corporate hospital, even in metros, there is an opening for the internal medicine. It's not going to be very difficult. At the same time, I do have started seeing that certain specialties in the super specialty segment, there is saturation in metros. For example, if you come to Bangalore, which is my city, you will find it very hard if you're a nephrologist to find a job. You probably need to go to the periphery of the Bangalore to find a job. But if you're a physician, you can find a job even in the center of the city, the best of the corporate hospitals. So there are some super specialties which are getting saturated. Medicine is not getting saturated. And even 15 years down the line, if it gets saturated, you will still find good opportunities in the tier 2 and tier 3 cities and the suburban locations and in taluka places and district places. So it's not going to be out of fashion. It was never out of fashion for that matter. If I start talking about my time, which is like I prepared for entrance exam almost 15, 16 years back. So during then, medicine was one of the top 3 specialties to get into. Yes, that was the time where radiology was most sought after and the orthopedics was most sought after. Then medicine was in the list. After that, things have changed. Now radiology is losing the position. A lot of people are going behind dermatology, but medicine always finds a place within top 3 or 4, always. So, right, if you are deciding to just stay with medicine, you're not at loss. That is what I would like to tell today. You're not at loss. But if you are launching for super specialty, then how do I decide what specialty suits me? Okay, so for that, you need to decide what kind of a person you are and what subject you personally like. But again, please remember, you might like a subject, but you may not fit the role of the that particular specialist. For example, I am a typical example. I like critical care intensely, but I do not fit in the role of a critical care physician because the physical endeavor required, the hardships that it puts into, I was not made for it. So I opted out of continuing with critical care medicine. But I still like critical care medicine. I still read about it. Whatever I read, I do implement on my patients. But full-time role as a critical care physician was not my cup of tea. So a lot of the students who get into super specialties later repent and struggle to live with it because they only heard their heart which likes a particular subject but did not practically think whether the life is going to be easy with that specialty. So first thing you have to decide if you are going with the super specialty training is whether practically it suits me, not what my heart says. Right. So for example, cardiology. Now, in cardiology, you talk about any level of hospital, tertiary, quaternary, or even the secondary care center, you will have fixed OPDRs, you will have fixed time dedicated for rounds. But apart from that, your phone will keep ringing with emergencies because acute coronary syndromes or acute chest pains are so common these days in the emergency rooms. So you probably would be traveling back and forth between your workplace and your home. So a lot of time will go in traveling. And if you're not made for this, if you're not made for getting up at 1 a.m. and then returning home again at 3 a.m. to get back to the rounds at 6:37 a.m., then cardiology may not suit you. But if you're a person who is passionate about it and you can bear the endurance required for this, then you can choose cardiology, right? So if you want a stable work life balance among the specialties that I have mentioned here, I think endocrine and rheumatology gives you a very stable work life balance, because the emergencies in these specialties are very limited in number. But if I choose endocrine, for example, I like cardiology as well as endocrinology. And because Dr. Santosh Patil is telling that cardiology is very demanding specialty, if I choose endocrinology, what is that I'm losing? Well, if you're choosing endocrinology, you're gaining freedom with respect to time, but you are losing financially. In the sense, cardiologists, though beginning in the beginning of their career, earn quite less today, as much as an internal medicine, or sometimes even less than that. But at the peak of your career, you might earn substantially more than what an endocrinologist would earn in his peak of his career. Okay. And whenever I'm talking about finances, please note that I'm not talking about entrepreneurial doctors. Right? Doctors are there who set up businesses, they set up chain of clinics, they set up hospitals, and they make them successful. Their revenue is totally different. I'm only talking about revenue from practice. When we talk about revenue from practice, at the peak of your career as an endocrinologist, you would not make as much as you would meet at the peak of your career if you're a cardiologist. So you lose something financially, but you gain something in terms of time and comfort. So the choice is always yours, but you have to keep in mind the practicality. If you are in the residency period and you're already struggling so much to keep pace with the work burden, then cardiology is probably not made for you. You will definitely find it very hard to live with. But during your this 3 years, you get adjusted to running between the floors, running between the wards, shuffling between OPD, ICU, and the ER. If it becomes something that you have ease with, then cardiology is definitely meant for you, right? So give time for yourself to decide, but keep in mind, just don't go by heart. Think of practicality. Okay, that's the first thing I would tell. Now, if you have done MD internal medicine and you're chosen to take, like, end your academic career at that point of time, and you don't want to go ahead with super specialty, right? How is it, how the life is going to be? What all I can do after my MD internal medicine or DNB internal medicine? Well, definitely you can set your clinic and you can have your own private practice. And I would recommend every of my brothers to have their own private practice, because do not rely on the corporate hospitals or established institutions for long term, because institutions can shut down and institutions can also kick you out. If you don't have your own patient base, it will become a beginning from scratch after you have been thrown out of the institution or if institution is set down. So always have, at least devote some time for your private practice, so that you always have a base. If the institution doesn't want you, you still have a base, your patients still want you. So devote some time for private practice, whether you make that as an exclusive source of revenue, or whether you visit different hospitals and also have a setup of your own, that I leave it to you. But definitely have own clinic or a setup for private practice, that everyone should do. The second thing is, you can definitely think of medical college as an option. Here let me tell you, you're already aware of the fact that medical colleges do not pay well. Most of us probably venture into a medical college because we don't feel brushed and sophisticated enough to get into the private practice after our PG. And that's the reality, because most of the medical college training level is dropped down by 1 year. Like what the SRs today are, where the output of PG output was of that level a decade back. So it has shrunk a bit. So when we finish our MD program or a DNB program, probably we're not confident enough to get into the private practice. And we need some more brushing, some more mentorship. And in search of that, either we can land up in a corporate hospital as a registrar, or we land up in a medical college as a senior resident. So in medical college, if you are from the DNB background, you all know, depending on the number of beds in your institution, whether you need to do 1 year SRship or 2 year SRship would be decided before you are promoted as an assistant professor. For an MD, we all know it is going to be 1 year. Okay, so from the SRship, you are getting promoted into the assistant professor. And most medical colleges, the role of an SR and an assistant professor is not largely different. At least in the peripheries and small towns, it's not largely different. You do the same thing, only the designation changes, and you might get a hike of few thousand rupees per month when you are promoted. So don't run behind the designation. If you're DNB and if it is taking one more year for you to get into the assistant professor position, it's fine, because it hardly matters. You would have lost maybe some 4 or 5 thousand rupees of promotion and that so-called designation of assistant professor, but you will still be doing the same job that another assistant professor would be doing. Okay. Now, with 15 years of experience in medicine, both practicing in private centers, working with corporate hospitals like Fortis, and also working with a oncology setup like HCG, and also taught in a medical college, also taught in entrance exam wings. I have a plethora of experience, and I can tell you one thing: medical college revenue, no matter what is your designation, whether you become the dean also, in today's world, it cannot match your requirements. Or like as doctors, you need to maintain a social status, and your medical college payout will not be sufficient enough to match that, right? Most medical colleges right now, like, to quote the numbers from Bangalore, for an SR, most medical colleges pay anywhere between 80 to 1 lakh per month, which for a city like Bangalore is nothing literally. So if you are joining a medical college to be an SR or AP, join there mainly because you need to learn little more medicine before you are ready for the outside world, not because you are there to earn. But yeah, whatever you earn, make intelligent savings, make good investments. So don't splurge, at least in the beginning of your career. Okay. Now, if you're extremely passionate about teaching, then probably you can continue medical colleges because you are passionate, not because the medical colleges are going to pay you well. In near future also, they're not going to pay you well. The pay might shrink also because more and more MD graduates are coming out now, and NMC has relaxed the terms and conditions and requirements for one seat of MD medicine. So more and more seats are going to come in the future. More and more graduates are going to come out. So medical colleges will have access to more manpower. So obviously the payout is going to be smaller. Getting a larger hike is next to impossible. But if you're passionate to teach, you can definitely join, and you can consider practicing in your evening hours so that you supplement the additional income required. Now, some of the students do ask me, sir, what is it like being in the entrance exam coaching? Is that a great career option? I would say yes, it is, provided you're fully dedicated to it. At least the subject of medicine requires a full commitment and dedication. If it is, let me say, psychiatry, anesthesia, or dermatology, it needs 7 8 days of your preparation and 2 days of teaching or recording, and you're done. But subjects like medicine, they're extremely vast. So if at all you want to venture into entrance exam teaching, you need to make a lot of career compromises. Initially, you may not get any offers, may not get any revenue sources, but you still need to keep working out. You still need to keep promoting yourself on social media and YouTube, and make lessons, reach out to the platforms which are looking for teachers, maybe work on side side aspects like making a Q bank or giving solutions to questions, addressing the recalled questions. Eventually somewhere you might land up to be the face of their platform, but it's a long journey. So once you are recognized at pan India level, well, the revenue that you get is definitely going to be more than what any successful physician could make from the practice. Most of the educators right now who are well known to all of you definitely earn 10 times or maybe 15 times more than the physicians earning, but they have spent years earning nothing before they came to this point. So one has to be aware about that, right? Okay, so teaching is one aspect, but again, as I've already told you, keep in mind that it's not going to be your financial uh, source. So you have to still think of the practice. Then the corporate practice. Now, corporate practice, the scene is a bit complex in the sense most of the corporate hospitals will take you in the initial designation called as registrar, which is equivalent to senior resident, right? So 1 year of senior resident post MD, or 2 years or 1 year, depending on where you did your DNB, you are an assistant professor. So you make a designation jump. 3 years into assistant professor position and 2 publications, you jump into becoming an associate professor, right? Once you're an associate professor, most of the colleges relieve you of night duties. You don't have any of those burdens, and you're back just doing the office hours in the college, and you're very much free to do your evening practice. But in the corporate world, From registrar to being called a junior consultant, most of the big chain corporate hospitals take around 5 years to make you a junior consultant, right? It ranges from 2 to 5 years depending on their need and the circumstances, but on an average it's going to take around 5 years. So what would you be doing in this 5 years period as a registrar? You're reporting to someone else, right? So someone else is a consultant, he is addressing to the patients, and you're doing the same job that you did in your PG days, right? You take the patient's history, report it to him. It can be frustrating to some, right? So if you don't want to go through that, what I would recommend is make the most use of your residency. Once you are passing out with the degree of MD or DNB, be confident enough for your individual practice. Practice in small setups and private practice. Concentrate on that. If you want to get a corporate career also, concentrate on private practice. Practice in small nursing homes and setups. Once you have substantial number of patients and also substantial number of experience, like depending on the corporate hospitals need 3 to 5 years, whatever it is, then you can approach the corporate hospitals, and at that point of time they would be more than happy to take you as a consultant because you have a patient base to say that you are bringing traffic to the hospital. Second thing, you have substantial experience, you're confident enough to handle your patients, right? And you also have the requisite experience by then. That would be a better route than sticking to a corporate hospital as a registrar. Now, there are a bit of politics here. What I've noticed is that there are some corporate hospitals which hire you as a registrar. You spend substantial time with them, and when they need a physician, instead of promoting you, they might still choose someone who has a patient base, because ultimately it is the number of patients that brings the revenue to them. It's not the loyalty of the registrar or the resident. So keep in mind that private practice is going to be very, very important for you. Never give up on it. No matter how big the opportunity comes your way, have your clinic, see your patients there. Give some time for it. Okay. So that's about internal medicine. Now, if you're someone who has already made up your mind that I'm going to stick to internal medicine, I'm not going to super specialize, then how do I handle my 3 years of residency? My suggestion is always different. If you are going for the super specialty, I would say something different to you. And if you're going for the internal medicine practice after your MD or DNB, then I would say different to you. So if you're someone who is already decided that you are going to stick to the internal medicine practice and not for SS, then I would say put your best physical efforts in learning all the required skills during your residency. I said all the required skills, right? Regardless of what patient it is, what specialty it belongs to, learn everything possible, because that will make your job a lot more easier once you're out as a practitioner. You will make confident decisions, impress attenders, and grow your practice. On the other hand, if you're someone who has decided to take a super specialty route and you're very clear about it, right? I'm not going to settle with medicine. I need to go for either endocrine, cardio, nephro, neuro, whatever you like. In that case, during this residency period, what I would say is I wouldn't say that neglect your internal medicine or all specialties. That's definitely not my advice. But make some time to read for your super specialty entrance exam. Aim for cracking it in first or second attempt, because if you've wasted some 1 or 2 years time after your PG, it becomes really very difficult to get back to the track, right? A lot of responsibilities by the time you would probably be married, or some of you might have kids. A lot of other family issues may be cropping up, and you will also be under pressure to start financially performing or start earning for the family because you were supported till now. Sometimes your income post PG may be less than your stipend amount that you were getting during PG. So all that starts mattering. So best thing is during your PG, like during your third year PG, you become eligible, and that's the best time to crack your NEET-SS. If not, the next year. Don't waste beyond that. Like you can join a medical college as an SR and crack it during your SRship period. After that, it becomes increasingly difficult. I don't mean that people have not done it. People have done it even after 41, 42 years of age, who completed PG in 26 or 27 years of age. But this is more easier route, right? Then how can we crack it? The best way to crack it is start preparing from the first year itself. So when you read something for your residency, for your MD exams or DNB exams, also read it from the perspective of MCQs. It will take only 10 minutes of extra effort for every 40 minutes of reading. 40 minutes of reading from Harrison, 10 minutes of solving a Q bank on the topic. Helps you to remember the theory better. You can write more objectively in your MD DNB exams, so the chances of cracking the MD DNB exam is also better. And because you solved the MCQ, now you're slowly inching towards your super specialty goal. Okay. And also remember that writing MD papers is an art, and it's a bit of a difficult art to acquire, because when we assess the MD papers, right, what we see is most of them don't know how to write. They don't know how to write because they don't know the subject objectively. So solving MCQs gives the objectivity. So you write specific points. You mention that this is the most common cause. Instead of just writing 10 causes for a particular disease, you mention this is the most common cause, this is the second most common cause, and in India, this cause is not reported. Now, this answer seems very pleasing to the examiner, and he is likely to push you towards the larger number of marks than just giving you passing or underscoring you. He'll give you a substantial score. So this objective understanding of the subject helped you to tackle your patients well, get good marks in your MD-DNB, and also get your super specialty. So dedicate some time for that. Okay, that is the first suggestion. And second suggestion is consistency is the key. If every day, no matter how you feel, good or bad, right? I can get up in the morning and maybe feeling really bad about the day, or you may be feeling really good. Regardless of whether you feel good or bad, consistently give at least 30 minutes of reading time every day throughout your 3 year of residency, and no one can stop you from cracking your NEET-SS goals in the very first attempt itself. But consistency is the most important thing. You might say that, okay, residency is hectic, I don't get time, I get tired. These are all excuses. These are not real reasons, right? So if your residency is hectic, you still get a 30 minutes window, right? I have not come across any residency program where even if the duty is 36 hours, you're on your toes round the 36 hours. No, you still get some 20 minutes, 30 minutes, a leisure time. Instead of swiping your fingers on the Instagrams or Facebook or texting your friends, you can definitely spend that time with books. And trust me, it makes a lot of difference to have consistency. Now, some of you probably would have got single digit or double digit ranks and then gotten into medicine. So I'm not talking about those people, but a lot of you have got fat numbers but still managed to get into medicine. See, for you, the difference between those who got the single digit numbers and got into medicine and you is that those people were consistent with their preparation, and probably you were not. I'm not finger pointing you, but you can make a change now. Be consistent with your preparation and you're sure to crack it. Okay. What specialty to choose is absolutely dependent on you, but I would definitely recommend you not just go by your liking, but go by the practicality, what it suits. Right? You may be already married, you might have kids, or you may be a female and you may be anticipating a marriage during your PG program, or you may be expecting kids in next 1 or 2 years time. Some of the super specialty programs may not suit your practical situation. So if you're going for SS, make a practical choice rather than emotional choice. That's the only take home message I would like to give to those who are going for SS. And if you're going for SS, PrepLadder NEET-SS is always there to help you. We have curated very precise content which is designed for NEET-SS. It is not borrowed from the NEET PG division, like you all know. So almost everything that's required for you to know for NEET-SS is being covered in recorded lessons. So along with me, Dr. Dilip is there, a very famous faculty, and all of you know him from the NEET PG days. And also Dr. Ganga. She is a nephrologist and she's an eminent nephrologist. She knows the subject very well. So she is recording nephrology, and respiratory medicine and gastroenterology I am covering, and rest of the systems Dr. Dilip is covering. So hopefully this will be a very good package for you. It will supplement your residency preparation. So during your residency, if you cannot read Harrison, if you're a person who listens and understands the subject well, then we have got you covered. And if you're a person who is more into reading but still find Harrison too vast to read, then the PrepLadder NEET-SS notes are going to be your perfect alternatives. And having looked at the notes, I do believe that you can probably write your MD or DNB papers also from these notes. You don't need to always go back to Harrison. And for NEET-SS, obviously there's a curated Q bank. Dr. Dilip is personally looking into the Q bank to elevate its level. So the Q bank will be apt. We have studied the previous year's NEET-SS papers, and we understand where the exam is placed and where it is heading. All that understanding of the exam is incorporated into it. So I would welcome you all to the fold of PrepLadder NEET-SS, and we will be connecting live repeatedly to discuss more issues, changing exam patterns, and also the issues that you face during your residency, thesis acceptance, rejectance, protocol, bullying by seniors, and everything that comes about residency. We will be discussing in subsequent live sessions. Thank you all. Signing off, guys. This is Dr. Santosh Patil, your PrepLadder NEET-SS medicine educator.